Okay. I'm going to pause it till we start, okay?
Hold on.
Good afternoon. Thank you. Thank you. And Carmen, can I just say one thing before you get started?
Yes.
Just wanted folks to use the chat and let us know whether you are a little bit about who's on the call with us today, and wondering if you are a data collection newbie or a data collection expert or somewhere in between. And if folks can be thinking about that, I will now introduce Carmen Sanchez, our project officer.
Hi, everybody. Welcome to the Parent Center Network webinar on data collection. We really want to emphasize that there's going to be new elements in this data collection in 2021. And therefore, it's really important that you pay attention to the differences and that you can respond as best you can. Because it is a new data collection, we realize that this first year is going to be more of a tryout. So just do your best, and in future years, it will get better. Next slide. So what we really wanted to focus on is what's new and sort of what remains the same. We're going to go into more detail in terms of the quantitative data and also the Part 2 program measure survey data. But I really want to emphasize why what's new is new. As you all know, the RSA grants have gone out to 8 centers, and also there's the National Center. And even though it's going out to 8 centers, 2 in each of the regions, nevertheless, RSA wants to collect data on the youth that's going on, the youth work that's going on in individual parent centers within that region. Therefore, RSA is requiring that some data be collected nationally across all the parent centers. So Carolyn and Miriam and Josie and I worked with project officer in RSA to see if there was a way we can come up with one data collection that met both the needs of OSEP and RSA. So that's what the changes are focused on. We don't want you to do 2 separate collections. It's one collection, some differences between those collections in order to meet the requirements of both the Rehabilitative Services Administration, RSA, and the Office of Special Education Programs. So this is going to talk to you about some of those differences. But let me also emphasize, you are collecting that data already. It's just a question of how you might present it and how you may send it on to SIPR in terms of collecting that data. That's the real difference. But you are already collecting data about the youth you serve. You're already collecting data about the kind of transition information. I think there's somebody talking. It may be Maria or Carolyn. Noise in the background. But you are already collecting this data about families of transition age youth and older. So it's not a question of the data you're collecting. It's a question of how you will be sending on that data and how you will be involved in doing surveys of some families. So I just wanted you to keep that in mind as they go over the information, that it's already data you're collecting. And with that, I'm going to turn it over to Carolyn to do the next part of the webinar. Thank you.
Thank you so much, Carmen, and thank you for all of your support as we have tried to go through this process. I'm hoping that my internet connection will hold up while I have my video on. I'm so glad to see so many of you who have joined us for the webinar today. For those of you that I don't know, my name is Carolyn Hayer, the director of the SIPR, and we're excited that you're here, and we really are striving to make this data collection process as less intimidating that maybe some of you have felt it has been in the past. And it's really all about making sure that we are able to highlight the wonderful work that is taking place across the Parent Center network. So if you have not visited the SIPR website, www.parentcenterhub.org, I invite you to do that. And we are charged with coordinating the Parent Center data collection each year. And Miriam, who you will hear from later in the call, has really been our long-standing data person. She and Maria Rodriguez as well have been doing this for a very long time, and we will be available to you throughout the process to provide any assistance and support that you may need. Next slide, please. So the data collection process itself may be trying. However, it's an annual process that is really an opportunity for us to give shout outs and highlight our work. That it's amazing work that you all have been doing, serving families, youth, and professionals. And it's a great way to have a little snapshot and share with others the positive impact and outcomes of the work that we are doing. Last year, we achieved more than 1.8 million contacts through training and technical assistance. And this was in the midst of a global pandemic. That is amazing. And just want to say congratulations and kudos to everyone for all of the work that you have been doing. And even more amazing is the fact that at least 90%, and oftentimes more, of the folks that were surveyed found that our programs and services met their needs, helped them to understand how they can get their child's needs met, and they were able to put the information that you provided to them to good use. And so congratulations to everyone on doing such a fabulous job. You'll see on your screen now the data in a little bit more detail with some more numbers. This is available to you on the Parent Center Hub. And not only can you access this information, there is an infographic available on the website that you can adapt so that you can share your individual center's data. And it's really great information to share with potential funders, with the community that you're serving, in your annual reports and other ways that you can really spotlight your center's work. And so we encourage you to do that. We can support you in creating an infographic like this for your center. And there's information, there is a guide available on the website. And so I would really, really, really encourage all of you to do that. I think we need to really highlight the wonderful work and really shine a light on the work that everyone is doing. So on the next slide, you will see we wanted to start to share with you a little bit about this year's data collection. So you just saw all the data from last year. This year, there are some changes that Carmen has already mentioned. The goal is to really make this a smoother process for parent centers by us working with Josie Badger at the RAISE Center to combine the data collection requirements of both OSEP and RSA. Carmen also shared with you that this is a pilot year. So this is an opportunity for you to see what the expectations will be moving forward. You're most likely already are collecting all of this data, but it may be that you want to change some of your data collection processes so that it will be easier for you to share all of the wonderful data that you are collecting. Josie will be on later to talk a little bit more about the 8 RSA TTI centers that are across all of the regions. And their goal is to provide TA to each parent center across the country. And so their TA is focused on employment and independent living and transition to adult life. And so you all are already doing that work. and we want to hear more about it, and we will be able to do so through this data collection process. So at this time, I would like to turn this call over to Josie Badger, the director of the RAISE Center, and she will talk a little bit more about the work.
Good afternoon and happy fall, y'all. So good to see all these friends on the participant list. So I am here to tell you a little bit about the RAISE Center and why and how this all fits together. As Carolyn mentioned, I am the project director, and Miriam, who you've already heard from, she is the assistant director of the RAISE Center. Can you progress the slides for me? Thank you, thank you. So I want to tell you a little bit about the RAISE Center if you do not know about us. So we actually started about almost 7 years ago. Wow. And we are housed at SPAN, but we are the National RSA PTI Transition Center. So we provide support to, I decided to have a tickle in my throat right now. We have 8 RSA PTIs that we support throughout the country who are there to support each parent center in transition and supporting transition for youth with disabilities and their families. So you each have an RSA PTI that is supposed to be serving you, and we are serving them to serve each of you. The RSA PTI centers provide TA related to employment and independent living goals, but we all know that we can't achieve successful adult outcomes such as employment if we're not addressing the holistic view of an individual and their family. And so that is a very broad stroke to ensure the success of youth with disabilities. When you start to do your data, you're going to notice that there are new survey questions related to your parent centers and your work with youth. If you are working with parents, you are working with youth, whether directly or indirectly. And over the past couple decades, there has been increased focus on young adults being served by the parent centers. And as was already mentioned, you all are already doing this work. Many of you are serving young adults. You're having trainings. You might have a youth leadership group. And so you're doing this work, but we want to capture that to make sure not only are we're counting it, but that we are serving each of you in the best way possible. So we are asking all centers to document this work that you're doing with transition age and older youth. And so what that looks like is we have questions of youth before transition age, whatever transition age is defined in your state, and above transition age, so that age and older. And those will be really important to help us support each of you. Go ahead. Oh, thank you. I'm so glad this is here. So this just says what I was trying to say better. Transition age, youth who are of transition age or older, under transition age, children that have not yet reached that age that your state mentioned. So for some states it's 16, some are 18, some are as low as 14. So whatever your state defines it as. Go ahead. I think that was the last slide. So before I throw this back over, I did want to mention that we, the RAISE Center, are always here to help you with transition, with working with young adults. If you haven't done so, go to the raisecenter.org website. We actually have a new website coming, same link, hopefully September 30th, so really fast. And you all, somebody from your center should have gotten an email asking about RAISE, and if we're supporting you right now, please make sure that somebody from your center fills it out. That will help us serve you all better as you're serving young adults. Thank you.
Thank you, Josie. Appreciate that. So now I just wanted to share a little bit about some of the changes. The first one being, for lack of a better term, the new buckets for collecting your data. Previously, there were 3 buckets, so to speak: families, youth, and professionals. This year, we've broken out the families group as well as the youth group into 2 separate groups. One that will count the number of families of youth and young adults under transition age, and as Josie noted, transition age as defined by your state. And then families of youth and young adults who are of or over transition age as defined by your state. And then the youth and young adults themselves who may have received services from your center who are under transition age. And then the youth or young adults who are of or over transition age, again, as defined by your state. And then, as always, professionals who you are serving. So those are the new data groups that are now required under the reporting process. This new process will meet the requirements of both OSEP and RSA and will hopefully streamline the data collection process for each of the centers. So those are the new buckets. That's kind of the what's new. And now I'm going to turn this over to Miriam, who's going to talk to you about what remains the same. Miriam?
Yes, thank you, Carolyn. So now let's discuss the process. Part 1, data collection refers to the numbers of contacts, meetings attended, resources disseminated, website visits that your parent center achieved in the 2020-21 program year. It includes the unduplicated parent count, disability data, and demographic data. For the demographic information, parent centers will need to report the number of infants, toddlers, and children under transition age, and youth and young adults of transition age and older served by your parent center. For the Part 2 refers to the program measure survey, where your center will ask a specific number of parents and youth and young adults of transition age and older about their satisfaction with the information of or services they received from your parent center during the last 6 months of the 2020-21 program year, which means from April 1st to September 30th of this year. Data submitted electronically. Like in the past, we have 2 forms, one electronic form for Part 1 and another one for Part 2. And CPR provides a randomized list of contacts to survey. Parent centers will send us their list of contacts, and the CPR will randomize this list and send them back to the parent center so they can conduct the surveys. And Maria Rodriguez, as you know, she's involved in this part of the process very much. Data is aggregated, which means that all data from every parent center is combined together. Therefore, it will become anonymous. Data is collected from multiple sources, which are the parent centers, and then it is compiled into data summaries or summary reports. That's what it means, data is aggregated. We have, okay, as it was explained before, now for training and individual assistant contacts, parent centers will have to report on their services to parents of children under transition age, parents of transition age youth and older, professionals, students under transition age, and youth and young adults of transition age and older. That is what Karen was talking about, the 5 buckets. So that's what we have. Let me move the, okay. All right. So we have, hold on 1 second, let me move it back one. Sorry. I am going to share my screen. sorry, this is for the part 1. For the part 1.
You can go back another slide, Miriam. I think that's where you went back. There you
Yes.
go.
Okay. Yeah, this is the worksheet that you will be using, and it is on the parentcenterhub.org website. Okay. And so I can show you, this is a screenshot. I am going to stop sharing, and I am going to show you the document. Okay. I have it right here. So it's pretty much what you're seeing on the screen. Okay. This is document. We just added, instead of 3 buckets, we have the 5 buckets that we mentioned here. And when they counting those for trainings and individual assistant contact. Okay, so pretty much that's what it is. I want to stop sharing, and I'm going to continue with the PowerPoint presentation. And this information, this document is available on the website, parentcenterhub.org. Under data collection, is right there. Okay. Right. So for the part 2, which is the program measures, the data you submit will be used as part of an overall assessment of the progress that the parent-centered program as a whole has made toward the long-term measures established by OSEP. These data are aggregated across all parent-centered reporting, and they will not be used or examined on the individual parent-centered level. So that's not the purpose of this.
Excuse me, Miriam. We're not seeing your screen.
Oh, I am so sorry.
It did not go back to the PowerPoint.
Okay, let me go back to share my screen, and yeah, I think it's this one. Okay, I had to make it bigger.
Yes,
Okay.
thanks.
All right. So the part 2, the survey has 7 questions. It is available in English, Spanish, and Korean, as in the past. The centers will submit, instead of 1 list, now it's 3 lists, because we need to now count the families of children under transition age, the families of children transition age and older, and the youth themselves, youth and young adults, and transition age and older. So those are the 3 lists now. And the zipper, so you send us the list, and we, Maria, will randomize the list like in the past. And the centers will get the list back randomized, and they will conduct surveys in prescribed order. And they will use the worksheet to combine and submit data. And the due date for this one is December 17th. I'm sorry. And for the other one is, for the part 1 is November 19th. It's just before Thanksgiving. Okay. So I want to share my screen because we have a template, and I want to share my screen with this one so you can see. We created a template. So it's going to make life easier for everybody. And I want to stop sharing and share my screen again, the template. And we even put numbers as an example. Okay, here we go. So this is an example, a template that we created of the list of contacts that you are going to send us, because we need you to send the list of families of children under transition age. Okay. And as before, you use a unique identifier for the family. We don't want to know the names or who they are. You know that. This is like the code that you know how to decode this. And this is for you, for your ease. You can put this here. And then your list, this list will contain all your contacts of families of children under transition age from April 1st to September 30th. So don't say anything now. We have to wait until the month of September ends before you start creating this list. So it's an Excel sheet. It has 3 tabs. The first tab is called FC because it's families of children under transition, families of children. And then we have another tab, FT. I'm not sure if you can see the tabs, but you will get it. It's also on the website. I put it over there. I put the template over there, this template, without the numbers, of course. And this tab is for the list of families of transition age, youth and older. Same unique identifiers, you know who they are. We don't need to know that. You will get them back in a randomized way. Usually we get lots of contacts. That's what you have to do. And then with the last tab is for the youth themselves, list of youth who are of transition age and older, that your center have served them during the last 6 months of the program. Okay, so I'm gonna continue with the presentation. I am gonna share my screen again. Okay, that is, sorry, part B. And then I am going to show you the instructions, and I'm gonna share my screen again. I have to stop this. This is the link that will take you from the Parent Center Hub to the actual area where you can find anything that you need. Okay, so you got it in an email, the link, but you go there to parentcenterhub.org, and I'm going to show you how to get there. I don't know if you can. Did you see my change?
Yes, we are seeing the
Okay,
website.
perfect.
Mhm.
Perfect. So yeah, either you can type here Parent Center data collection, or you can click here because it was recently uploaded, and you can see everything you need is here. Even frequently asked questions page. We have the form itself, electronic form here. We have the dates. We're going to have drop-in calls, and know that we changed the dates because there was a conflict with the SPICL date, and also with there's a holiday November 11th, so we have to change the dates. These are the new dates: September 30th, October 7th, October 28th, and November 4th. They are all Thursdays at 2 p.m. Eastern time. And these are very informal. So it's not going to be a webinar format. It's going to be more like a meeting, informal meeting. So you can come and we can meet with you and ask questions directly. And you can ask questions and we respond to you. And so everything you need to know about data collection is right here. What else I need to do? Okay. The forms, the documents, the service in Korean, Spanish, English, scenarios. All right. The dates, when they are due, all that. And okay, so I'm gonna stop sharing because we need to have some time for questions, and I'm gonna continue with the presentation. And okay, back and forth. Sorry about that. Zoom is not that easy to change, but you all know that because everybody's using Zoom now. Okay. So, okay, I show you that. That's the link. It will take you there. And I also mentioned that we have drop-in calls. These are the dates. Okay. And you will get, everybody who is here today will get an email with the link on Zoom to join the drop-in calls. Okay. And what else? All right, now we have, Karen is gonna explain how to get information about data collection on Centers Connect.
Thank you, Miriam. So I just wanted to remind folks about our new platform, Centers Connect, which is really designed to help parent centers to collaborate and communicate and network with each other. And there's a link on the slide for how to reach Centers Connect. It's also available from the Parent Center Hub, registered user drop-down menu. I wanted to let everyone know that there is a space on the site called Evaluation and Data Collection. And this is a space where you can ask questions through this process, either directly to the SIPR or to your parent center colleagues. The information that's been shared today, the forms and the process and the overview, those documents will also be housed on Centers Connect. So just wanted to let you know there are multiple places for you to find and access support as you navigate through this process. Next slide, please. So just wanted to let everyone know who is on the SIPR team, and also to remind you that the SIPR works in very, very close collaboration with the 4 regional parent technical assistance centers to provide support to you. And your RPTAC can also assist you through this process. So we wanted to remind you to reach out to them as well. But if you have any, we're going to take questions for the rest of our time today, but if you have additional questions or concerns, you can always reach out to Miriam or to Maria at the SIPR. And really the message is we're all here to support you. Next slide.
Yeah, and we have some questions, actually pretty good ones.
Okay, all right. Yeah, I was trying to respond to some in the chat, which I will continue to do. But Miriam, if you can kind of respond to anyone that wants to unmute and ask a question. And there's also some questions in the Q&A area.
So Carolyn, this is Carmen. I'm going to give you the questions sort of in order that they appeared, which is there's
Excellent.
a question as to whether or not you only submit the unique identifier to the SIPR. And my understanding is that that sheet, Miriam, that you showed is there for people to put down information about the families they contact, but all you need is the unique identifier. You don't need contact information at all, correct?
That is correct. So
Okay.
the only required column in that sheet is the unique identifier. Other centers sometimes send additional information, but that is not required.
And sending other additional information, you may be breaking the confidentiality of the family, so you may want to be careful about doing that also.
Mm-hmm.
And then there's a question about using the transition age of the state, because in the state, the transition age is 16, but the state's RSA VR services start at 14.
Yeah, I tried to respond to that. I think we might need to reach out to RSA for guidance, but perhaps Josie might have
we had,
feedback here.
and Carmen, correct me, but we had decided to go with the age that the school starts to implement transition plans in the IEP. So normally that's between 14 and 16. There's some that are, lower or higher, but so under your transition planning for your IEPs. So it's not necessarily VR at all. This is Josie again. I do want to just encourage all of you that you are right. There are some parents who historically have not been giving ages of their kids. We haven't necessarily asked for it, but I think in the future, as we start moving forward, asking for the birth year of their children, and that's multiple plurals for whoever they're receiving services for, is going to be important so that we are targeting resources correctly. And so we know that right now you might not have birth years of everyone, but I think that's something hopefully we can start building as we move forward.
Correct. That was, same thing. Again, we mentioned earlier, this is a pilot year. So we understand you may not have that information organized that way for this year, but moving forward, you will be needing to collect that information.
Yeah, there's a question here that it says, is there an age limit on above, on, of, or over transition age, youth and young adults? And actually somebody who is a person who is maybe 40 years old can call your center a self-advocate, and that person is counted. So
It
it's
should
not
be
only
counted.
26. Yeah.
Yeah, it goes up to 26. Yeah.
But we're,
Not saying to not help them, but they are not a youth.
yeah, but it's transition age and older.
Right now, we are collecting an older, correct?
Mhm.
Julie had a question that she thought she could start the surveys now as long as they went back 6 months. And I believe the answer to that
Yep.
is yes, you just can't send a list until after September 30th to include everybody else you might be serving in this month.
Correct. And I did one, I saw a question from Courtney. Will the questions being asked of youth be different from those asked of parents? And also youth can be notoriously hard to track down. And what happens if we can't get a hold of enough of the youth to meet our quota? So the first part of your question, there is some flexibility in how you ask the questions. There are some scripts available on the webpage to help with that. So we're hoping that that will be sufficient. You can certainly reach out via email, texting. I do think youth are difficult to track down, particularly by phone. And I'm not quite sure yet what would happen, but I think that that we will cross that bridge when we come to it, unless Carmen, you have a different thought, but we've not had an issue with folks not being able to reach the required numbers in the past.
And so a couple of things. One, to be clear, it's the same questions. It's just a
Correct.
question of how you ask them so that the
Amen.
youth can understand the question better. And just like you can ask parents by phone calls, you can ask them by emailing them a survey, whatever your process is, you can use whatever you find works best with youth. And what was the other question in terms of reaching the quota, or what was the second part of the question?
What happens if we can't get a hold of enough youth to reach the quota?
You did your best. And that's fine. And you could just put a note in the data collection that you exhausted the youth you were supposed to call, because they'll send you back the list of every youth. It's just in randomized order in terms of who to contact, that you reached everybody. And, you know, you did your best. You can put a note to that effect. Let me also say that you also have the option of asking youth, for example, at the end of a training, as long as you can connect whatever response they give you to that youth, you know, you can figure out a way to make it work. If you think after the training or after that contact, it may be super hard to get a hold of them again.
There's a question about the consent. If the parent center need consent from parents to contact underage youth, and consent, if consent is needed, is then, I'm sorry, denied. That's a good question.
I would say if consent is denied, that should be noted and move on.
What? And am I right or wrong in saying that generally there's supposed to be consent when serving these young adults at an individual level anyhow, if they're under 18?
Well, and I would assume that, remember, you're calling folks that you've already provided services to. So I don't know if someone wants to clarify that question further.
Paola Jordan.
Hi.
And also, there's a question about, the required number of surveys will be the same as last year. So actually it's gonna be less. In the past, it was 10%. Now it's gonna be 5%.
The number of surveys. Yes. There's a question about serving where you have parents of multiple students who are under over transition age. Does one count that family under one and not the other, or count twice, once per child? If you provided services for both of the students or children, then I would count twice. If they only called about one, then the information would be related to the child that they called about. And the other part of that question is, if a youth enters transition age during the grant year, does that youth get counted as their age at the end of the time period? You should count based on their age when they called you, when the service was provided.
There are many good comments here. Maria
I'm
says, yeah, best practice
through.
for working with underage youth would be to have parental consent prior to working with that youth. It's a good idea.
Another question was, if you had parents that had training and they don't mention how old their youth are, I would honestly start adding that to the survey feedback or your intake for any of those, like, are you here because of your child who's of transition age or older? And that's just something that we'll have to start developing over the next year.
Nelsania says this is about contacting the youth after training, for example. I don't think it's appropriate to approach an underage person that attended a previous training. No, you would give them permission and ask, and like I said, it might make more sense to do the actual survey right after the, right at the training as the training ends to get these answers, knowing it would be difficult to find them. It may be difficult to, you'd have to go through the parents to talk to them. So, you use your best common sense in terms of getting in contact with youth.
Okay. What? I'm sorry, I'm just reading through. What if we don't have the age of the children of the families attending trainings? What bucket do they go in? So you can ask the question, and that might be something, again, the survey can also take place immediately. But if you don't have that information, then you would have to move on. Over time, you should be collecting it though, if you can.
And if your data system knows that the family called to discuss transition age and said their children are involved in transition, then you can assume their families of transition age youth.
Yeah, there's a question from Rich Overton. Just to confirm, we need to also break down the demographics by under transition age, and older. The smart sheet breaks that down, but it's not clear on the online data collection form. Yes, it has to be broken down like that way. Right. Thanks.
And someone else raised the point about the difficulty collecting some of this information, particularly with virtual presentations. We absolutely understand that. There certainly will be limitations, but part of this process is that we want you all to be thinking about and considering the ways to change how you're collecting the data so that you will be able to report this with more fidelity as time is going on. We certainly recognize that this is a pilot year.
And Kala asked for this year, though, which bucket would they go in? I'm not sure which group are you talking about, Kala Brinkley.
I
Okay, it was
see.
answered already.
Oh, go ahead. Oh,
Mhm.
okay. And there's a question, will we have comment areas when we submit our data to let you know if we had trouble collecting specific data
Yes.
points?
Absolutely.
Yes, and we want your feedback as much as possible. And so, as Miriam mentioned earlier, there will be 4 sessions where for drop-in calls, that's another opportunity for you to ask
Mhm.
questions such as this, but also to give us your feedback. So we are
Yeah.
very interested in hearing from you.
Yeah, I would like to clarify something that kind of came to our attention last year when we were on pandemic mode already. Okay, we have several parent centers asking us how do they count meetings with the families virtually, right? So the answer is, and it's over there on the Q&A, but I want to make sure that people get it correctly. If the meetings are taking place in a synchronous way, they should be counted as phone calls. So if they are happening in real time, if they are taking asynchronous, it means like you respond and then an hour later the parent or the youth responds and back and forth, that should be counted on under emails, text, and others. I wanted to clarify that.
Thank you, Miriam.
Also, another question that came to us, which was clarified, but I want to make sure that people get it too. We are doing a lot of things virtually, as you saw the numbers that on the infographics. The virtual trainings should count. What you count over there is the number of participants and unique page views. Those are the ones. And for the social media, you need to count reach, not your number of followers, the reach, which is the number of users who have seen your content or post. And you can track that data using the social media analytics, the tools that are available on the different social media platforms.
Bonnie asks, she says that when she conducts post-training evaluations, they're anonymous, and that's right, they are anonymous. You might just want to consider whether or not the participants have the option of attaching their name to their evaluation and explaining that in doing so, you may not need to contact them again, for example, if you have those evaluation questions in there. So yeah, it is a problem because most of the time they're anonymous, but this will give you an opportunity to think about maybe better, ways of collecting the data that will work.
And to that point, I think it's important to be able to, when you're submitting your data, make sure you have a way of knowing the folks that you have already surveyed, perhaps at the time of service, so that when you get the randomized list back, you may in fact have already conducted some of those surveys.
And Nilcinia said that some of the questions, question 5 is like, are you prepared to use the information? May not be so applicable right after. But Josie, for the youth, do they have to have question number 5? I forgot if we were
What was
asking them.
number 5? Sorry, it's not in front of me.
That's the question about you're prepared to use the information you received in the last 6 months. I don't remember whether or not we came down on whether or not that would be necessary. We'll get back to you, Nilcinia, with that.
Yeah, the question has changed slightly from the previous years.
They have.
So yeah, there are 7, but they're a little bit different, right? And there's a question from Paola. Can you repeat the part about virtual meetings, why they need to be counted as phone calls? Okay. Yeah, that's how we came to the conclusion last time, because we haven't changed the form itself. It's similar. So it's more, we thought it was more like a phone call than a text or yeah, and it's
Or in
technology
person.
coming us or in person, exactly. So it needs to be counted over there. And there's also I need to explain more the synchronous comment. Yeah, synchronous means when the correspondence is taking place in real time. For example, you are meeting on Zoom, for example, or you are meeting on FaceTime, or your meeting is on text, but it's happening in real time, that is called synchronous. And when it is how it is asynchronous, when it's not in real time, when the correspondence happens, and so that the parents and the staff responds, and then the youth or the parent responds back or asks something, it's not happening as in real time. That's counted as asynchronous. So that should be counted as email or text. So
May I also show part 2? Because I think that might answer these questions about, can you use this in the next 6 months, or thank you. Oh, I need whoever's sharing to not share. So
you want to show the form or the
yeah,
slide?
the form for part 2.
Okay.
I can show it too. I have it up.
All right.
Yeah. So as Carmen mentioned, part 2 does look a little bit different. Now, this is the Word doc. This is not exactly what you may see, but you will see that we do count the number of families of children under transition age, of and over transition age, and the number of youth. You will see these lovely green and white boxes here. And here are the questions. The information or support you received from blank met your needs. You were able to understand the information you received. The information provided helped you learn more about how to meet your needs or the needs of your child. The information provided was useful. You are prepared to use this information. Now, this is where, this one was the one in question. And then you feel confident in your ability to work with school or service providers, including VR. You would recommend this parent center. We did not, as you can see in this form, we did not say they couldn't answer this. And I guess we did hint at the fact that potentially for the young adults, asking these questions directly following a session may be easier to track them down, especially like I know a lot. Some young adults are frequent flyers, and so they'll attend a lot of sessions, and they might not remember if a session was helpful or not. So it would be possibly useful to do it and the session.
Yeah, somebody else is asking about to add the additional explanation regarding what you mean by synchronous and asynchronous. Yes, it is over there. It is on one of the last questions on the Q&A area of the data collection website. It is explained over there.
Susan Henderson brings up the fact that using Zoom meetings was more of a replacement for in-person because it allowed them to share documents. So I guess, Susan, you're suggesting whether or not it should count as an in-person meeting instead of a phone call. So that's how you recorded them, as in person. Okay. We can have discussions in SIPR and seeing whether or not we change the direction slightly then. It seems like a lot of people record it as in-person meeting because of the ability to share documents and the like.
Makes sense.
Agree. This is why your feedback is so important to us.
Maria asked whether or not the likelihood of new or increased survey questions will not change. The wording in the survey questions right now was so subtle, and it wasn't for the intent of it. It was rather just to make it that it's clear that youth could answer those kinds of questions, but the questions are remaining identical. And we will do our best not to have any additional requirements in terms of the survey questions moving forward.
So Paola asks if we can share the Q&A we are having in this chat or summarize it and be part of the upcoming calls. That's a great idea. We do have.
Yeah, I just put it over there, the Q&A.
As well, the Q&A. Great idea. I think it's Alejandra, who's asking, Teresa Drum had asked this question, and I'm also curious about it. How are services provided to parents without age of child provided, reported the undisclosed age? So if I'm understanding your question correctly, I do think that there are contacts that folks may not have collected the age of the child. And what we're saying is we want you to start to have your data system set up so that you can get that date of birth. Is that answering your question? And Christy, sorry, is asking, can we find this PowerPoint on the SIPR Hub? Yes, we will get that up. I'm not sure if Miriam has it up yet, but it will be on that same data collection page that we've shared the link for.
And the recording too. We are recording this.
Right.
The number of responses needed for each survey. Every parent center has a different number. It depends on the total that they have. It's going to be 5% for each list that you submit to us.
Okay, I think we're reaching our time, so let's see if we can do the last couple of questions.
There is a question here about double reporting. So let me make it clear that as far as OSIP is concerned, we're okay if you're reporting to us numbers of transition-aged youth and families also, because we expect you to serve transition-age families. It's just separating them out for RSA purposes. So it will get sorted in the data reporting. So as long as you give SIPR a separate list for the numbers and for the survey, I will work with them in order to make sure that the numbers are correct. But if the same family, for example, got services from you for a non-transition age youth and a transition age youth, you know, and you reported it's in your numbers to the SIPR for OSEP's data collection, that's not a problem. So don't worry about that. Just focus on providing SIPR the list that they need in order to get the right surveys and the right data to RSA.
Okay, thank you. It is 3:02, so I want to just take this opportunity to thank everyone for joining us for the call today. I did post in the chat the dates for the upcoming drop-in calls, which will be another opportunity for you to join us, to ask questions, to get clarification. We're looking forward to working with you and hearing about all of the wonderful work that you are doing in terms of serving families. So thank you so much to Carmen Sanchez, Dr. Josie Badger, Miriam Elizo, Maria Rodriguez, and myself. We thank you for joining us today and wish you a wonderful rest of your day. Thanks so much.
So while we wait for people to get off, maybe some of these other questions can be addressed when they call in drop-in calls, correct?
Yes, I think we should go through and,
Really good.
write them down and have those responses and make them available to folks, and probably collect more as those drop-in calls go forward.
Right.
Okay.